Nursing care of clients with inflammatory cardiac disorders. And this is part 1, where we will talk about rheumatic heart disease and infective endocarditis, also called IE. Rheumatic fever is an inflammatory condition involving the connective tissue in the body. Its most severe complication is rheumatic heart disease. This condition may permanently damage the heart valves and therefore affect the flow of blood to and from the heart. Symptoms of heart valvular damage often don't appear for sometimes 10 to 30 years after the initial episode of rheumatic fever. Strangely enough, rheumatic fever is a systemic inflammatory disease, and it's caused by an abnormal immune response to pharyngeal infection by group A beta hemolytic streptococci. It is thought that antigens from an abnormal immune response bind to cells in the heart, muscles, brain, and synovial joints, which causes inflammation. Carditis may develop. Damage to valvular structures may occur. Here we see some of the signs and symptoms or manifestations of rheumatic fever. Chest pain, friction rub, heart murmur. The patient may also develop a migratory polyarthritis, erythema marginatum, subcutaneous nodules over joint extensors, and Sydenham's chorea. Rheumatic fever is a complication of a group A streptococcus pharyngitis or strep throat. The vast majority of people with strep throat do not develop rheumatic fever. However, in some people infected with the group A strep, the body's immune system not only fights the bacteria but also attacks its own tissue, especially heart tissue. Risk factors for streptococcal infection of the pharynx include environmental and economic factors such as crowded living conditions, malnutrition, immunodeficiency, and poor access to health care. There may also be a genetic factor in susceptibility to rheumatic fever. Prompt identification and treatment of streptococcal throat infections helps decrease the spread of the pathogen and the risk of rheumatic fever. The importance of finishing the complete course of medications, or I should say antibiotics, should be emphasized to patients who are diagnosed with strep throat. As we see here, the characteristic white drainage patches on the tonsils. So to decrease the spread of the pathogen and decrease the risk of rheumatic fever, it's important to implement measures to prevent rheumatic fever. These include an emphasis on early and effective treatment of strep throat. If a child, for example, has a sore throat and a fever, then it's a good idea to have them checked out by their physician, okay, because it does have this sequela, as we call it, something that can cause a lot of damage to the heart muscle and valves. So we do emphasize early treatment of sore throats to make sure it's not a strep throat infection. If it is identified as strep throat, then it's important that we treat it. And we need to treat it effectively by completing the full course or prescription of the antibiotic. People who have a history of valvular heart disease and rheumatic fever are often prescribed prophylactic antibiotics before they are scheduled for any invasive procedures in the hospital or even in the dental office. Okay. Here you see those white patches on the tonsils. And so those are very characteristic of strep throat. Group A beta hemolytic strep appears like this. We see those also the inflammation of the tonsils and the obstruction of the airway. So it can be dangerous in terms of access to an airway, and it needs to be treated. The antibiotics that are given to treat strep infection include penicillin. But if an individual is allergic to penicillin, other antibiotics, including erythromycin and clindamycin, may be given. In addition, the patient will probably be treated with an anti-inflammatory medication, aspirin, or some other non-steroidal anti-inflammatory drug from our NSAIDs classification. And that can help with any joint pain or swelling that may occur. And then again, you could use corticosteroids as an anti-inflammatory if the NSAIDs are not effective. Again, rest is also important. If inflammation is severe, the doctor could prescribe bed rest or a severe restriction of physical activity for a period of time. So again, if you or your child has a sore throat and a fever that lasts more than 24 hours, it's a good idea to contact the physician and get that checked out. And not because you're not going to survive the strep throat. Of course you will. People do all the time. They may have a fever. I mean, it will go away in time. In a few days, the fever will go away. But the problem here, when we ignore that and don't treat it with a full complement of antibiotics, is the risk of the sequela. And the two sequela that you should know about, you've probably learned about already one of them, but I'm talking here today about heart disease that can result, especially valvular heart disease that can result from a rheumatic fever. Let's see. And the other one that that I don't really teach about, but it's something that you should have gotten somewhere in the program regarding the other sequela that's very concerning when children get strep throat, because they can also develop an acute glomerulonephritis. Okay, so that is something that I hope you've studied before, but you can have an acute glomerulonephritis that can affect the kidneys of an individual as a sequela to a strep infection. So again, another very important reason to have that treated. Well, to diagnose the invading organism that we see in endocarditis, the nurse should anticipate drawing blood cultures, receiving orders to draw blood cultures. So, but we don't wait for the blood culture results to come back, because that can take 24, the preliminary report maybe in 24 hours, but then it's going to take at least 48 hours for them to grow the microorganism in the laboratory, in microbiology lab. Okay, so we will probably go ahead and get them started on antibiotic therapy, and they may have to continue taking antibiotics throughout their years, depending to prevent recurrence of a rheumatic or endocarditis. If they've ever had it one time, they will continue to take penicillin, for example, to prevent recurrence, especially before any type of invasive procedure. Now, this is where I like to talk a little bit about the misuse of antibiotics. They say that the overusage of antibiotics is causing a major downfall in our society. Despite the instructions on the bottles, there are many people who stop taking the drug when they feel better. This creates a huge issue for scientists who are forced to create a stronger and stronger prescription to fight these bacteria. The bacteria which are causing the illness will mutate to accommodate the antibiotic if the prescription is not used to its full extent. So when you misuse antibiotics, you're putting the world at greater risk for infection. The bacteria simply get stronger and more resistant to the antibiotic. The select few bacteria which survive reproduce and create more of their own resistant kind. That is why it's always important not to cut your antibiotic course short simply because you are feeling better. And this is a picture of a superbug, as an organism that is resistant to many antibiotics. I selected 2 patients that have had rheumatic heart disease as a result of rheumatic fever. One on the left, you may have heard before. Her name was Patsy Cline, and she died tragically in 1963, a long time ago. I believe she died in a plane crash. But before that, she also had another close call with death because she had a serious case of rheumatic fever when she was 13 years old. And Patsy Cline always recalled her good fortune, so to speak, that illness brought her. Because she says that the fever that affected my throat, and then when I recovered, the fever affected my throat, and when I recovered, I had this booming voice. So it did affect her voice, her whole bout with strep throat and rheumatic fever, but it left damage to her heart. Remember, when the heart valves are damaged, this puts the patient in the position of developing heart failure. And so look at the position she is assuming here. There's that orthopnic position where she's leaning forward, propped up on several pillows. It helps her breathe better because she now has heart failure, all because of the valvular damage. And then we see another patient, a young girl as well. On the other side, she's 11 years old. And in this case, because she had so much cardiac valvular damage due to rheumatic fever, they had to replace her valves, one of her valves. It was an artificial valve that was used to replace the damaged heart valve from the rheumatic fever. So she goes in periodically to the cardiologist, and they use ultrasound to assess the functioning of her new valve. Okay, so remember, echoes are used for assessing the structure and function, so they can see how well her heart is doing with this new synthetic or artificial valve. And it's also kind of interesting because when you do have a mechanical valve, an artificial valve, it's not unusual at all that they can hear their own valve opening and closing, especially if they're laying still and it's quiet. They can actually hear the clicking of their own heart valve when you have a mechanical valve. Now, infective endocarditis is inflammation of the endocardium, or the endocardial lining of the heart. It is generally infectious in nature, although there is some non-infective endocarditis as well, which is simply a sterile blood clot before it gets infected. But what we are going to be mostly concerned about is IE, or infective endocarditis. It's generally infectious and results in colonization of the cardiac structures by a pathogen. And that's what you see in this picture. For some reason, when this pathogen enters the bloodstream, it loves to set up shop on the cardiac valves. Any of the valves can be involved. I just happen to be showing you in this picture some leaflets on the mitral valve on the left side of the left ventricle, between the left ventricle and the left atrium. So we have the mitral valve in this picture, and you can see the colonization of the pathogen, and we refer to those lumps or growths as vegetations. And in fact, they can grow quite long and actually flap in the bloodstream, out into the bloodstream as it rushes across those valves. Let's see. Development of endocarditis requires entry of pathogens into the bloodstream. Vegetations of pathogens form on the cardiac structures, most commonly the valve leaflets, but it can be anywhere on the endocardium. As these vegetations grow, they interfere with normal movement of blood through the heart. And a very important thing to think about, and it poses quite a risk to patients, is that the vegetations may also fracture or fragment off and embolize, meaning pieces can break off and travel through the bloodstream. Okay, and so that acts just like an embolus, just like it was a traveling clot. Risk factors for infective endocarditis include the presence of congenital deformities of the heart. And so that's one thing. Congenital heart defects is one of the topics that's included in your self-study module. So I definitely want you to take a look at that. So when people are born with a congenital deformity of the heart, that can increase their risk of developing infective endocarditis. Also, tissue damage due to ischemic disease, and we just learned all about ischemic heart disease. Valve prosthesis or valve replacements, mechanical valve replacements as well, can increase your risk of infective endocarditis. And we already said congenital deformities, but how about invasive catheters? Okay, they can certainly introduce pathogens into the bloodstream. Dental procedures, you can put a big star there because we need to remember that's very common, is dental procedures or people who have poor dental health can be at increased risk of infective endocarditis. Remember that the mouth is and the oral membranes are highly vascular. And you know that because it doesn't take anything but a simple flossing that can cause our gums to bleed. So it's very easy for bacteria in our mouth to get into the bloodstream. Also, any type of recent heart surgery puts a patient at increased risk of IE. Education of susceptible or at-risk people is a key part of prevention. Clients with pre-existing heart valve damage or replacement may require prophylactic antibiotic administration prior to invasive procedures, including routine dental work. Now, there are different classifications of endocarditis. It's not to spend too much time on, but there is an acute and a subacute infectious endocarditis. The difference here is acute has an abrupt onset and a rapid course or progression. Subacute infective endocarditis has a more gradual onset, and some of the signs and symptoms can be rather nonspecific and what we describe as flu-like. okay, with things like chills, fatigue, fever, malaise, things like that, okay. In this picture, we again see the vegetation of the pathogens or clumps of material growing on the infective valves. And we also see it in another location in the endothelial membrane, endocardium, not endothelial, endocardial membrane. Also, as part of that infective vegetation, we also have debris and small blood clots. So they're shown there on the aortic valve. So it can be any valve or somewhere lining the heart chambers as well. Now, this slide addresses peripheral manifestations of infective endocarditis. Okay, nursing questions love to go here, okay, to see just how knowledgeable you are with IE. So let's talk about the peripheral manifestations. They occur from microemboli or circulating immune complexes, and they include petechiae, splinter hemorrhages of the nails, Osler nodes on the finger and toe pads, Janeway lesions on the palms and soles of the feet, and Roth spots on the retina. I would suggest or encourage you to look up the definitions and descriptions of Janeway lesions and Osler nodes so that you can have a clear distinction between the two. They are different, and so I wouldn't want you to miss any questions related to those. There are common complications of endocarditis, including embolization, as we said, of the vegetative fragments. Also, a common complication is heart failure. Without treatment, endocarditis is almost universally fatal. Antibiotic therapy is generally effective in treating the disease, but it requires a very lengthy course of antibiotics. Because on the heart valves, there is not a blood supply to the heart valves. So taking just an oral antibiotic is never going to reach the site of the infection. Okay, so it requires intravenous administration of antibiotics. The therapy is prolonged over a number of weeks, sometimes 6 to 8 weeks of IV antibiotics. Also, the fibrin that covers the vegetation, those lesions, protects them from antibiotics. So generally, again, a prolonged course of therapy is necessary. We would like to be able to send them home with a PICC line, for example, because that can be kept in place for weeks to months, and then we can have a home health nurse administer their IV antibiotics. But this, again, is not a good treatment plan if the person who has infective endocarditis is an IV drug user. And I bring that up because that is really one of the most common patient populations that develop infective endocarditis. It's almost always an IV drug user that has introduced the pathogen into his bloodstream in this manner. I mean, not almost always, but it's seen so commonly that it's very characteristic for them to develop infective endocarditis. Nursing diagnoses involve risk for imbalanced body temperature because they get a fever, risk for ineffective tissue perfusion because we're having destruction of the cardiac valves and heart failure, and also ineffective health maintenance, especially regarding our IV drug user patients. So there's many signs and symptoms We talked about the peripheral signs and symptoms, but here is another acronym that may help you in remembering the many signs and symptoms of infective endocarditis. The acronym is, or mnemonic is, pathogens. Pathogens. Well, pathogens cause the vegetation on the heart valves. So in this case, P would stand for petechiae, A for anorexia, because a lot of the anorexia stems from the fact that the spleen, which is involved in the immune system, becomes large and presses against the stomach. So the patient has very little appetite, they're tired, and they have a high fever, and H can also stand for heart failure if that develops. The O stands for osseous nodes, and the G for the fingernails or the splintering hemorrhages of the fingernails, and E for embolic events, which, in other words, a fragment of this vegetation can break off and become an embolus. And then we have N for new murmurs. Sometimes these patients will develop a new murmur. You'll listen to their heart and you say, oh, you have a heart murmur? And they're like, no. Has anyone ever told you you have a heart murmur in the past? No. So this is a new murmur. Also, the N can stand for night sweats, and then S for the splenomegaly. Now let's try our luck at some NCLEX style questions. This first one is straightforward. It is a select all, it's a multiple choice question. A patient with endocarditis has listed in their medical history Roth spots. You know that this is a complication of infective endocarditis and presents as, and hopefully you got the answer. It is C. It's a retinal hemorrhage with white centers. Another NCLEX style question. Again, it's multiple choice. A patient is receiving treatment for infective endocarditis. The patient has a history of IV drug use and underwent mitral valve replacement a year ago. The patient is scheduled for a TEE, or echocardiogram, tomorrow. On assessment, you find tender red lesions on the patient's hands and feet. You know that this is a common finding in patients with infective endocarditis and is known as, if you selected C, osseous nodes, then you would be correct. What are the typical signs and symptoms of infective endocarditis? It says to select all that apply. A is correct for hyperthermia. C is correct for enlarged spleen. F is correct for heart failure. And G is correct for cardiac murmur. Okay, so you should get 4 answers there as typical signs and symptoms of infective endocarditis.